Hello everyone, I'm Dr. Namrata Sandhu from NS Doc Talk, and today we'll be talking about this tiny little friend of yours, which is literally the only period product you'll ever need if you learn to use it well. Now, menstrual cup is a reusable feminine hygiene product which is both safe and environment friendly. Now, what makes this menstrual cup so safe? It's the fact that it is made up of medical grade silicone. Now, what is medical grade silicone? Medical grade silicone means that it is tested and approved by FDA for biocompatibility, which means that it is approved and it's safe to be used inside the body. Medical grade silicone is also hypoallergenic, it is latex free, contains no toxins, it is non-porous, and it resists bacterial growth. Medical grade silicone is completely inert, and it is the same material that is used to make implants, urinary catheters, and vaginal rings. So it's completely safe to use and does not react with your body. Now first, I would like to explain the menstrual cup to you. Now the menstrual cup, this is the body of the cup, this is the rim, and this is the stem of the cup. Now around the edge of the cup, you can see these tiny air holes. Now what is the role of these tiny air holes? Now these tiny air holes make sure that the suction is in place and you don't leak through your clothes. Now you must always make sure that these tiny air holes are completely clear of any residue or any product, because just in case something gets stuck in the air holes, what can happen is that the suction will not be maintained and you might leak through your clothes. Now this cup also has markings on it for you to track your period flow. Now this is a medium sized cup, and here it says 7.5 ml, 15 ml. So you could also probably keep a track of the amount you're bleeding, which I think is pretty cool because you can actually track your period blood flow and see how much you're bleeding. Now another great advantage of the menstrual cup is that these menstrual cups sit right below the cervix, which is the mouth of the uterus. So they collect all the blood that is flowing out from the cervix as compared to tampons, which absorb the menstrual blood, and they also have a tendency to dry out the vagina. The menstrual cup, compared to the tampons, only collects the blood, it does not absorb it. So in fact, you're slightly more likely to catch an infection with tampons compared to menstrual cup, because the cup just collects the blood, does not absorb the healthy vaginal discharge along with it. To use a menstrual cup well, we need to learn the process of insertion and removal. But before that, let me give you an anatomy tutorial. Now I'll be using this mold first to explain to you the female reproductive tract. Now this right here is the uterus. These are your two ovaries. This part here is the cervix, right, which is the mouth of the uterus. Now this cervix is the one which juts down into the vaginal canal. Now the vaginal canal is like a tunnel with cervix at one end and the other end is open. Now the vaginal canal is only open at one end with the cervix at the other end. Now the menstrual cup is going to sit right here and it's going to be collecting all the menstrual blood. A lot of people generally ask, can the menstrual cup get lost in the vagina? It really has no place to go, because the vagina is only open at one end. The other end is the cervix. So there is no way your menstrual cup can get lost. A little bit more about the female anatomy. Now compared to males, females have three openings. The first opening is the urethral opening from which you pee. The second is the vaginal opening from where you menstruate every month, and this is the same opening from where the baby comes out. The third opening is the one from which you poop. Now compared to the females, men generally have two openings. One opening from which the urine and the semen comes out, and the second from which the poop comes out. Now I would just like to show you the cross section right here. Now this is the urinary bladder where you store your urine, and this is the first opening from where you pee. Now this is the uterus right here. This is the vaginal canal, which is more like a tunnel. This is from where you menstruate and the baby comes out. And this is your third opening, which I had explained earlier, from where your poop comes out. Now the menstrual cup is available in different sizes, small, medium and large. And the type of cup that you're going to pick will depend on a number of factors. One, your period flow. Second, on the position of your cervix. And third, also on the fact whether you've given birth or not. Now I would advise you to actually go to the website of the brand where you're going to order your cup from and check out their sizing guide, because every brand has a different sizing guide, and I think it would be the best option for you to go on the website and check the best size for you. Now once you've bought the right cup for yourself, the first step to do is to sterilize the cup. Now to sterilize the cup, you could buy a sterilizer in which you can sterilize your cup, or you could simply put it in a pan of boiling water for 3 to 5 minutes. The only precaution that you need to take is to make sure that the cup does not stick to the base of the pan, because then it can burn. So you could hold it with a pair of tongs, or put in adequate water so that the cup is floating. You sterilize it for 3 to 5 minutes, dry it, and it's ready to use. Now the next step is insertion. Ideally, you should try, even if you want to practice, you should try practicing it when you're on your period, because there is natural lubrication and it's much easier for you to insert the cup. Or else you could also use water-based lubrication to make the process easier. Also, before insertion, you must make sure that you're completely relaxed, because the more relaxed you are, the easier it will be for you to insert the cup. So take deep breaths, completely relax yourself, and then try inserting the cup. Now, there are 3 positions that you could choose from to make the insertion process easier. The first position is squatting, because it helps to relax the vaginal muscles. The second thing you could do is sit on the toilet seat and then try inserting the cup. The third, you could put one foot on the toilet seat and then try inserting. The idea is to be completely relaxed. Now the next thing is to fold the cup. Now there's several folds available. You could check on YouTube and find the fold which is most suitable to you. I'll just show you 2 folds. The first is the C fold, where you just fold the cup like this. You know, the cup is here and you just fold it like this. And the other preferred method is the punch down fold, where you just pinch it down like this, so that the smallest diameter is there to insert. Now punch down fold is more popular because I think it makes sure that you get the smallest diameter in. To demonstrate the insertion, I'm using a mold here. Now you need to hold the cup at an angle, aiming towards the base of the spine. Gently separate the labia with your hand and push the edge of the folded cup into the vaginal opening until it is all the way in. The stem of the cup should be sitting around 1 centimeter from the vaginal opening. Once inserted, the cup will pop open and remain in place with the help of the vaginal muscles. Once inside, the cup should feel smooth and comfortable. Alternatively, you could also run your finger around the cup to make sure that it's completely open. In case you feel any dent or you feel that the cup is not completely open, what you could do is just go slightly above the stem and pinch it, and you will see that the cup will pop open. And once the cup is properly inserted, you can also give a gentle tug at the stem to make sure that the cup is in place and a proper vacuum has been formed. But don't yank on the stem and pull out the cup. The cup can be used safely for 10 to 12 hours. But it will also depend on your flow, how heavy it is. If your flow is really heavy, you could also change the cup after 6 to 8 hours. Now the next step is removal of the cup. Now before removing the cup, you have to make sure that your hands are completely clean. And what you're going to put your finger inside and try and look for the stem of the cup. Once you've located the stem, just go slightly above it and pinch the cup to release the suction or vacuum. And you'll be able to take it out comfortably. The stem is going to be your guide, but do not pull on the stem and yank it out, because you need to release the suction. That's very important. Some people also find the stem to be too long, so you could even snip it. Once you remove the cup, empty the contents of the cup, and all you need to do is wash it with water, or you could use a mild fragrance-free soap, and it's ready to use again. But you need to sterilize the cup once your period is over, after 4 or 5 days. Whenever your menstrual cycle is over for that month, then you need to sterilize the cup and store it away and use it in your next cycle. When you wear a menstrual cup, the menstrual cup actually warms to your body temperature and moves with it, instead of rubbing and causing friction. I do agree that there is a learning curve involved here. It takes a few times for you to get used to the menstrual cup and how to use it. But once you get used to the menstrual cup, it's super easy to use. So that was all about menstrual cups, and my next video, we'll be doing a question and answer session on your most commonly asked questions on menstrual cups. Thank you.